Hello, my name is Tony, and I'm the owner of Alamo Slim Clinic. I made this little video to help people understand what my program is all about and answer the same basic questions that everybody has when they first find our marketing material and are looking to get answers to your questions. So if you've already tried the GLP type of medicines, the semaglutide or tirzepatide, I might be repeating some information that you already know. But for people that have never tried these weight loss shots before, I'm going to go over the basics now of what we offer at Alamo Slim Clinic to help people lose weight. These new GLP medicines were approved for weight loss about 3.5-4 years ago. It's taken the country by storm ever since then because they really work well. Usually somebody sees someone else in their circle, their friends or family, losing a lot of weight, and they really want to know, how does that work? The other reason these things have spread so fast across the country and across the world is because the doctor community, the medical community, is fully on board, because these medicines not only work well to help lose weight, but they're improving people's lives, because all of the long-term studies show that the comorbidities of being overweight, such as cardiovascular disease, high blood pressure, strokes, cancer, among other things, are significantly increased the longer that we are overweight. And the doctors have found that by people losing tons of weight on these GLP shots, those risk factors, those comorbidities, significantly are reduced in all of the long-term studies done on these GLP medicines. People have been taking them for 6, 7, 8 years or longer for diabetes reasons. And the long-term studies of those people have significantly reduced cancer risk, stroke risk, heart disease, and so forth. So the doctors are widely prescribing them, these medicines, because they see the long-term benefit of reducing people's weight and improving your long-term health. So without further ado, I'm going to talk about the original medicine. Everybody knows about Ozempic or Wegovy. Those are the brand names for a drug called semaglutide. Semaglutide is the original GLP-1. We offer that in our clinic. We have the generic version of that. We don't carry Ozempic or Wegovy itself, but the generic compounded version. And let me just say, a lot of people don't understand what a compounded version is. Basically, compounding means any generic drug. They'll be 99% the same as the name brand drugs, but there's 1 or 2% different additives in there. Same as if you buy Walgreens ibuprofen, it's 99% the same as Advil ibuprofen, who originally had the patent. But I buy Walgreens ibuprofen, and it's the same medicine, okay? So we have the generic form of semaglutide. We also carry the generic form of tirzepatide. That was the second GLP, very popular medicine to come out. And, you know, a lot of people then ask, what's the difference? Which one should I try? So I'm going to explain real quickly just the subtle differences between these two medicines. The semaglutide is a GLP-1. That means there's one receptor, the GLP receptor in our brain, that this hormone, these GLPs are basically peptides or hormones that it affects, and it turns off our appetite and our food cravings. When you eat, I want you to think about this for a second. We go from feeling hungry to feeling full. How does that magic happen? It's a hormone in our body called leptin. And when leptin gets released, when our body feels that we're full, and our brain sees that in a receptor, and our brain sees that in our blood and turns off your appetite. Just your food cravings go away. Someone comes to you for dessert after you've had a huge meal, and you just feel like, no, I don't want that. I'm full. I can't eat anymore. That's our body's natural way to turn off its appetite. Well, our food supply is not releasing enough of this leptin when we eat our foods in our world in these days. Research is showing we just don't release enough leptin. And when we release some of it, it burns off fairly quickly and we're hungry all the time. Well, these new GLP shots are affecting that same receptor in our brain, but we're putting an injection into our belly fat with a small insulin syringe. It slowly absorbs into our blood over the next 24 to 48 hours, but it lasts 1 week before it completely wears off, and then we need another shot. So these shots are weekly, but during that whole time, our appetite and food cravings are kept quiet. Our brain doesn't turn the hunger back on because it sees that hormone in our blood and thinks you've eaten. The second thing that it does is it raises our metabolism a little bit, so we're burning more calories along the way because your body kind of thinks it has to digest some food. So during that week, studies are showing that you'll eat about 30% less food, less snacking. You just don't feel like you normally do, so you're going to snack and eat less. That combined with the raised metabolism leads to the weight loss, okay? My patients in my clinic, system-wide, average about 10 pounds per month coming off. So if someone needs to lose about 30 pounds, you should expect to be on the program about 3 months. If you need to lose about 60 pounds, you might need to be in a program about 60 months. It's almost like clockwork. It slowly and steadily comes off. 1 week might be 3 pounds. The next week might be 2. The next week might be 4. The next week might be 0. The next week 3. It might vary a little week to week, but at the end of the month, it's usually around 10 pounds. So let me now change gears to talk about terzipatide a little bit. So with the semaglutide, I said there's one receptor in our brain. Terzipatide was developed a little after Ozempic and semaglutide, and it has 2 different receptors in our brains that it's working on. And I'm not going to get too technical on these receptors and hormones, but just suffice it to say, the second hormone added to terzipatide affects the fat-burning metabolism of our body more so that the semaglutide isn't doing. The combination usually leads to a little deeper weight loss for people who need to lose a little more weight. Some of the clinical studies showed terzipatide could go a little bit deeper. Both medicines, I have patients lose weight, around 10 pounds a month, both, but sometimes terzipatide can go deeper. The other major difference is they somehow developed it, and I'm not going to get into the weeds on how, but it has a little bit less side effects such as nausea. That is the main side effect with these medicines, or possible nausea and possible constipation, maybe a little bit of acid reflux. As they slow down our digestive system, they can cause constipation. And most of these things are mild and can be remedied with over-the-counter medicines, but the nausea in semaglutide is usually complained about by more people than with terzipatide. They're possible with terzipatide, but in my practice, in general, nobody complains about nausea on that medicine. The one catch, and there's always a catch, it costs a little bit more. Everything's relative to what somebody thinks is a little bit more or a lot more, but the cost is higher from the manufacturers for that drug. So right now I'm going to get into the pricing a little bit in a second video because prices might change over time. But for now, I'll touch on that in the next video in this series. So the other thing, we're open Tuesdays through Saturdays. We're not going to be open on Sundays or Mondays. It's another common question, is what days we're open. So Tuesday through Friday, we're open 9 to 4:30. Saturdays, we're open 8:30 to 1. Another common question is, do we ship? Yes. I have customers all over the state of Texas. We're in San Antonio with our real clinic, full-service clinic. Anybody that's in the area that can't make it in, or anywhere else in Texas, I ship all over the state. I have customers everywhere. I have very aggressive pricing. and very good customer service. What I'm known for, what my customers really appreciate that we do in our clinic kind of better than everywhere else, is the customer service, but custom dosing. What do I mean? These medicines all have a regimented schedule of where to start on the medicine, at what dosage levels, and stair step up. All doctors use the same schedule. However, through my practice, I found that a lot of the people, it's not as simple as taking a vitamin and it works the same for everybody, okay? Some people need a lot of medicine before it starts working. Some need a medium amount, and some need right out the gate on the lower doses. It works well, but everyone's different, and I don't really know how it's going to work for you. But I had so many clients come to me that couldn't get it to work at online places they bought it from or other clinics that were more of a med spa. They might be good at Botox or something like that, but they really weren't weight loss people. What we concentrate on is only weight loss. This is all we do at our clinic. And we got really good at dosing people and finding the sweet spot with customized dosing regimens that actually work for them. So we're good at finding that. And if it didn't work somewhere else, usually they come to me and I'm able to get it to work by getting the right dosage. Something else that we provide, I also give diet advice. I give a food list of the kind of foods you should be eating and what we should not be eating while on GLP type of medication. So that's included in our services. We also have a 3D body scanner in the clinic that measures your, not just your weight, but your body composition, how much fat you have, how much muscle you have, how much bone density you have. And as you go through your journey of losing weight, we want to be losing fat and not muscle. And that is one risk of being on a GLP medicine, of losing muscle. So we concentrate on tracking that along the way and making sure you're losing fat and not muscle. And one of the ways we need to do that is a little bit of strength training. You need to get some dumbbells. If you keep your muscles active, you shouldn't lose them. But that's something that we need to talk about and concentrate on. So I want to thank you for tuning in. These are the basics so far. I'll leave you with one last question that's always asked, and that's our location. We're located in San Antonio on Highway 10 at the Callahan exit. We're right on the access road. And if you just go to your maps and search Alamo Slim Clinic, all of the maps know exactly where we're located. And I think that's it for this first video. Thanks if you tuned in all the way to the end. I appreciate your time. Simply call the number anywhere in the material that you see if you want to book an appointment, if you're ready for the next step. And there might be another video to look at if you're worried, concerned about what the prices are. That'll be the next video. Thanks for tuning in.